A 20-year-old woman comes in after a suicide attempt. The patient has had depression for multiple years and has seen many psychiatrists, and all her trials of medications have failed. What is the best treatment for this patient? A. TCA, B. SSRI, C. ECT, or D. MAOI? I'll let you answer the question, and then I'll explain in 5 seconds. Okay, so the answer is going to be C, ECT. So for this question, this patient has a long history of depression and a suicide attempt and multiple failed therapies. So the other therapies that are typically used are going to be SSRI first line, and then if an SSRI doesn't work, you can use a different SSRI, or you can move on to different classes such as MAO or TCAs. The only problem with this is MAOs, so monoamine oxidase inhibitors, have multiple side effects, and TCAs, which are tricyclic antidepressants, and all the other antidepressants can cause suicidal thoughts. So this is something that you need to alert the patient to before they begin the medication. But the biggest thing is that this patient has said that they have failed multiple other therapies. So these three are typically in the first three that are given to patients that have depression. So if she's failed all of these, then giving her these medications again are not going to help her. So for this patient, we need to give ECT. So that's electric convulsive therapy. And so this type of therapy is really helpful for patients that have refractory depression. So depression that's has failed with using other medications. And so ECT induces therapies in a sedated patient and helps provide rapid treatment. Remember that these medications typically take a long time to take effect. So for example, SSRIs can take up to 2 months to have an effect. And so using this would really help give her some relief from her depression, and also help in the fact that she's failed all the other answer choices. So for this question, recognizing a patient that has refractory depression and essentially needs urgent treatment indicated by the suicide attempt is an indication to using ECT. And so that's why for this answer, it's going to be C. So I hope that helped, and thanks for watching.